Welcome back. Coronavirus is all over the news, and for good reason. This virus spreads easily and is contagious, but is it the big thing we need to worry about? We're going to talk about that right after this. Welcome back. My name is Tammy and this is Nurse Minder, and on this channel we do everything nursing. So if you're new here, consider subscribing below so that you get the next video when it's released. Welcome back. We are talking coronavirus today, and I want to give you some up-to-date information to help you prepare and prevent it from happening to you and caring for maybe those who are around you that are affected by it. So the coronavirus is also known as COVID-19. CO stands for corona, VI for virus, D disease. And 2019 is the year in which it was discovered. So COVID-19. Now, COVID-19 is actually just the name of the disease. It is caused by the virus SARS-CoV-2. So that's the name of the virus that causes the disease. Now, corona itself is a group or family of viruses that is commonly found in animals such as camels and bats. And, I didn't put it down there, camels, bats, and I forget the others. There are a few others. And it's not as often found in humans, but it can be transmitted to humans, as we have seen in the SARS outbreak and in the MERS outbreak, and now we're seeing it again in the COVID-19 outbreak. It is a virus, so this is really important to know because antibiotics will not help you. So coming into the physician's office and looking for treatment, well, there really isn't any treatment except for symptoms, and we'll talk about that. Now, corona itself is from a Latin word, and it means crown or wreath. And you can see how beautiful this coronavirus would be sitting on someone's head. It is absolutely stunning. However, we don't want it hanging around in our nose or in our lungs. So what happens is these viral spikes, as they're called, or proteins is what we call them in healthcare. They are like keys. They're like the lock, and a key will open them up in order to cause a change inside the cell that they attach to. Now, when they attach to places like in your nose, it causes you to have runny nose, stuffy nose, kind of some congestion. We get more concerned though when it attaches to the cells in your lungs, because then it starts to interfere with the oxygenation. And that is usually what brings people into the hospitals, because they're feeling short of breath and they need support in their respiratory system. So we give them things like oxygen. Now, corona itself is a large family of viruses. Here it is: camels, cattle, cats, and bats. Almost sounds like a rhyme. And these are known as reservoirs, and humans are reservoirs as well. What does that mean? Is that these viruses cannot move and transport on their own. They actually need a host cell, and so the animal will transfer from one animal to another. Humans, what we know about this is how it's transferred is through secretions, and we're going to talk about that as well. But it's these spikes that latch onto those cells in the body, and then they create changes inside the cells functioning that results in the symptoms that we are seeing. Now, we know that this started in China. That's where the epicenter is, and that was the center of the outbreak. And we think it's linked to a seafood market and live animal market where the first transmission from animal to human occurred. Later, this has now spread from person to person, and at first it caused a lot of concern as to how it's being spread, which is why we saw a lot of pandemonia about how do I protect myself? And we know better now, so we're going to give you the goods. It then spread outside of China and it went to Australia, Canada, the US, where we're starting to see cases of this. Now, the good thing is most of the cases are mild, which means you're just going to feel like you have a flu, cough, cold kind of thing. There's a small percentage of people that end up coming into the hospital and staying in the hospital for prolonged treatment. And what I read from the CDC website today is that, in fact, children are not being as affected as we normally thought. And it is more the people who have weakened immune system, our elderly population, who can't create the antibodies. Because currently what's happening when this virus enters our system is we have no defense mechanism against it. It is an unknown, and your antibodies need to develop to protect you and create a defense. And if you have a weakened immune system, you're less likely able to do that. So what do we know now? This is March I'm not even sure what day it is, guys. March 4th. It is March 4th, 2020. So you'll always want to be keeping up to date with your Center Disease Control or your hospital policies to make sure you're practicing in the best practice for the day. But let's talk about what we know. First of all, we know that it transmits through respiratory droplets. So when people cough and sneeze, those larger droplets are going through the air. And so we want to stay at a distance of about 6 feet away from people. So that's almost 2 meters if we can. Now, of course, working as healthcare providers, that's an impossibility. So I've got some information for you on your protective gear coming up. Those sneeze particles can travel a meter or so, and they hang in the air for about 10 minutes. Like, they're large, heavy particles, but they can still hang around for a while. Now, we do not know, I was unable to determine from the research how long these particles stay on contact. So if you come into contact with a surface in which those infectious particles have landed on, and you touch it, and then you touch your face, like we love to touch our face, we've now given that virus from the desk or from the countertop a route of transmission. We've become its legs, and we have brought it to a port of entry, which could be your mouth, your nose, your eyes. So we want to be watching out for those contact with infected surfaces. Now, the incubation period is 2 to 14 days. This is why when you see people on that cruise ship that had to stay out there for several weeks at a time, or they get flown back in and then they go into quarantine for 2 weeks, that's because after 2 weeks, if the symptoms have not presented, it's considered to be that they are not infectious. So anywhere from 2 to 14 days, you may start to see the symptoms, but that means you're infectious. You can pass this on even though you don't have symptoms, which is part of the reason why it makes it difficult to contain, because people feel healthy, they don't know there's something wrong, and they go out there, 3 days later they feel sick, and then a week later half your office is sick, right? Isn't that how it always goes? For sure. Okay, signs and symptoms that you want to look for are very similar to a flu, right? So we feel run down, we feel like we got the sniffles, and we have a cough, a fever maybe, and short of breath and a sore throat. In terms of diagnosing it, there is a test called the SARS-CoV-2 RT kit, PCR kit, and that is a laboratory test that they will run to determine if you are a carrier or if you're infectious with this disease. I don't know how long it takes to get this test result back, so if somebody knows, that'd be great if you could add that to our conversation in the comments below, and just share what you know about this test and how, I mean, sometimes tests aren't conclusive. Maybe this is just an aid, or maybe it is a diagnostic. I'd love to know a little bit more. Now, in terms of treatment, there is no antiviral. You can't take antibiotics, so we're really looking at symptom management. If you have a stuffy nose, we're going to recommend that you take an antihistamine. If you have a sore throat, we're going to say gargle with salt water and take a medication to help soothe the pain there, like a cough syrup. If you have a fever, take some Tylenol and drink lots of fluids. So it's really symptom management at home and in the hospital, should you be in the hospital. Now, the best way to prevent it, this is important. This is why there's a lot of talk about hand hygiene. In fact, just this morning on the radio, there was this debate about how long should I wash my hands for? And I can understand that there is some concern around the length of time people wash their hands. 20 seconds is the minimum. Good soap and water lather, 20 seconds. You know, they say to sing the happy birthday song, but there was lots of fun today on the radio about different songs you can use to get to 20 seconds. Of course, if you feel like you'd like to go longer, you're more than welcome to do that. There is no harm in going longer. Now, if you do have a cough, you want to use your cough etiquette and cover up your mouth when you cough. If you use a tissue paper to do that, make sure the tissue goes in the garbage and you're washing your hands afterwards. The masking of people, so that we see a lot of people in community wearing masks right now, and for the most part, they're not necessary. If you have symptoms, the reason we mask you is so that you're not spreading those microorganisms to other people. So that's one of the reasons why you'll see people in the hospital, in the waiting room, at the triage for emerge, wearing a mask, is to protect others around them. Now, these masks that you see in this picture here, I hope you can see it that very well. These are typical face masks. They don't seal out everything. And so there's a risk still for the virus to get inside should you be near somebody. And as a public person, like in the public, you don't need to get a special mask at this point. Just maintain your distance. Healthcare providers will be wearing a specially designed mask that is tested for their face in order to protect inhaling those microorganisms because we do work so close with our patients. Disinfecting your surfaces, absolutely. You know, we talked about how contact is one of the ways in which this virus gets legs and moves around. So cleaning your surfaces with a disinfectant. Now here's some key things. I know you probably can't read that, so I'm just going to read it to you. Don't touch your eyes, don't touch your mouth, don't touch your nose. Primarily putting a mask on your face is kind of like a clue to not do any of those things. So if that makes you feel comfortable, go ahead, wear the mask. I'm not going to say otherwise, but really the mask is more just a barrier so that should you touch your face, which we all do, it's going to prevent that transmission. And if this virus can't get where it needs to go, guess what? The virus is gone, done, boom, boom, boom. We won't have to worry about it anymore. So let's do our job, people. Self-quarantine if you are ill. Don't go out, don't go to work, stay home. Take care of your symptoms. If you need something from the store, call a friend or a neighbor if you can. Or Uber delivers, maybe they can pick that up for you. I don't know, I've never tried it, but yeah, stay home if you're not well. If you actually need to go to the doctors, absolutely go, but maybe call ahead and let them know, and they can give you a mask as soon as you arrive. Now, healthcare providers, I know you can't see this, but I'm going to talk to you first about some of the things that you need to be aware of. First of all, in terms of your precaution, this is three, your standard precautions, your contact precautions, and your airborne precautions. So you'll be wearing an N95 mask. Most likely, check with your facility to make sure that we are not putting ourselves at risk. So you want to be also looking at your donning and doffing routine to make sure you're following that protocol to minimize the risk of transmission. Hand hygiene, hand hygiene, hand hygiene. Before and after patient contact, before and after environmental contact, after being in contact with infectious materials, always wash your hands. That can be with the sanitizer, so 1 or 2 pumps there, a nice good lather, air dry. It's important not to let that rub off with a towel, or soap and water 20 seconds. And that's it. So stay up to date with the information so that you can keep yourself in the best position to help your patients. It's one of the competencies of nursing is being aware of the emerging trends, and this is definitely an emerging trend. So until next time, stay safe, wash your hands, and make it a great day, guys.